Holdsworth Medical Group is happy to present the Weight is Over Health Chat with Dr. Nancy Evans and Sherry Good. They will be discussing a comprehensive and integrative approach to permanent weight loss. Our center has a proven track record utilizing HCG along with hormone balancing to help our patients obtain optimal weight. Dr. Nancy Evans is the first naturopathic doctor to join Holdsworth Medical Group, and she brings a holistic approach to the center. Sherry Good schedules new patients and assists the doctors with the HCG program. Our health chat will begin in just a few moments.
I struggled to lose weight. As a matter of fact, I was gaining it. So I went to the doctor and he said, start eating less. Less? I said I was eating 1,000 calories a day. He said, well, that's what happens when you start getting older.
Once I hit puberty, I started gaining weight like crazy. I went to my doctor, they told me I had a thyroid problem, so they gave me some medication, but it wasn't working. All they told me to do was just deal with it.
My mom's overweight and has diabetes. My sister's gaining weight. I'm gonna end up the same way, aren't I?
Since I've hit my 40s, I've noticed a lot of changes. But the thing that bothers me the most is my weight gain. I hate my weight gain. It seems there's nothing I can do about it, and my doctor keeps asking me to exercise more.
I got food cravings that I can't control no matter how hard I try. There has to be a reason for my uncontrollable food cravings. I need help.
Good evening, everybody, and welcome to Health Chat number 3. Now remember, Health Chat number 1 and 2 you can still access online. We talked about perimenopause at the first chat, menopause at the second one. So there's a lot of great information. Please go in and check that out and just stay connected to us. Also tonight we're going to answer your questions. So if you have any questions, those of you online viewers at home, you can send them to us through Facebook or Twitter, and we'll get to them during the second part of the chat when Sherry is speaking. So, the wait is over, right? It really is. This is probably one of the most troubling issues when we talk about our health, especially for women, because it's a visible issue as far as a medical concern, right? It's not just something, gee, we have kidney disease or hypertension, which nobody else can see. So it affects the way we feel about ourselves. It affects our self-esteem. It's our appearance, our attractiveness, and our relationship with the environment as well as everybody else, all of our relationships. So it's definitely a mental, emotional issue, especially for women. We are more emotional than men, so it does seem to affect us more strongly. So we're going to look at it. We have to take a comprehensive approach. I would love to say, here's the magic bullet, take it and you'll be skinny, and that's the way life goes, right? First of all, it's not even a goal. What we're looking for is optimal weight for your body type, your character, your heritage, your ethnicity, and everything. Okay. The other thing I just want to mention too, my purpose for these health chats. My goal is to help you attain optimal health so that you can live out your purpose. So it's really important to really stay connected to your core self no matter what health issue we're talking about. And you may need to rework that, especially if you're middle-aged. Things have changed for you. But I want you to always stay present with that goal and that purpose in your life, because it is going to affect your health really whether you know it or not. The other thing I want to say is that we believe you, right? You saw the videos before I started to speak. I've had countless patients come in and say, I promise you I'm only eating 900 calories a day. We've had other patients come, and I'm still gaining weight. We've had other patients come in and say, really, I am. I'm exercising twice a day. I'm doing these heavyweight workouts. I'm doing cardio, everything. I'm doing everything right, building a lot of muscle, but I'm still not losing weight. We believe you. Okay? I've had patients come in and say that the doctor told them, oh, you must be binging in the middle of the night. We know it's not happening. So what we're going to find out is that weight, if your weight is inappropriate, it's just like any other signal that the body has to show us. For example, if you're we take your blood pressure and you have hypertension. That's a signal. It's your body's way of talking to you and telling you that something is not optimal. And then we have to attend to it. It doesn't always give us the perfect key to the source. We have to do some investigation. But it is just like any other symptom, just like low back pain, hypertension, shortness of breath, anything like that, fatigue. And so we're going to take it in a comprehensive picture of all of your symptoms. The other thing is I've never had anybody come to see me with only one symptom. So you want to make sure that when you do talk to your doctor that you're getting this comprehensive approach, that you start doing a review of systems. How's your energy level? How is your sleep? How is your digestion? How's your immune system? You get a lot of colds and flus. How are your hormone levels? What's going on with your cycles? You want to make sure that you're reviewing all of these systems in the body, seeing if you have any symptoms, and that's going to give us another clue as to the cause of your weight gain. And also just give you some more comprehensive view of some other issues that might be going on inside your body. So when you go see your doctor, you want to make sure that first of all, they listen to your concerns. Second of all, that they believe you. If you see any kind of glazed look on their eyes, you need to find another doctor. Then you want to make sure that they take your concerns seriously. Now sometimes we might recognize that there's something deeper or different going on in your body, so we should take it in with a full picture. What you think is the most serious symptom might not necessarily be when we look at a comprehensive view of your health. But we want to make sure that your doctor takes your symptoms seriously, because you know your body better than anybody else, and you know when you're not functioning appropriately. So you are here to guide us as well with that kind of symptom in the body. And if you want to make sure that your doctor will take a comprehensive approach, especially if you're around 40 or older, if you're midlife, check your hormones, check your thyroid, check your adrenals. And we're going to go through all this, and I'll show you why, because it does directly affect our weight. Okay? So let's get started. And also later on, we're going to have Sherry come on. She's going to talk to you about a special weight loss program too. So we're going to add that into the mix. So here we are with our weight. Okay. What are the causes now? This is your main symptom you've come in with, especially if you're middle-aged or older, but even some young women will often, right, you've known people that young women who've said, as soon as I turned 16, I put on all that weight, and I've had a hard time ever since. So that's a really common scenario that we also see. So when you come in, you're saying that you can't lose weight. I'm going to ask you some other questions. How's your energy level? I rarely get somebody who says, who's quite overweight and says my energy's great. Are you having any other symptoms? Hair loss? Is your outer eyebrow thinning? Are you one of these people that's cold all the time? Do you put socks on to sleep in? We call that the cold sock sign, and it's pretty much indicative of low thyroid. So we're going to ask you a series of questions, and it's related to the thyroid. This is the first place we look to for weight. Why? The thyroid is a gland in the neck, and it controls our metabolism. What does metabolism mean? Our ability to burn calories, to burn calories to give us energy. So when our metabolism is right, we eat well, we make energy from it, we can move around, and we burn the appropriate amount of, we use up energy in order to do our daily activities. So thyroid controls this metabolism. When our thyroid is not optimal, the body is just concerned about survival. It's just keep your heart racing and let go of things that don't matter in the body. So one of the first things that doesn't matter is weight. And the thyroid kind of has this mechanism. If it can slow down our metabolism, it'll conserve energy. So it actually is your body's survival mechanism. And middle-aged and older, we really start to reduce our thyroid function. Again, when we're young, nature is concerned about survival and procreation, right? That's why, oh, when I was 20, I used to eat ice cream cones every night, and it didn't matter, because nature is just involved in helping us survive and procreate. After that happens, nature's not as concerned with us, unfortunately. So we have to fine-tune our health a little bit more. So some other things about the thyroid is with some other ways to check it. So when you go see your doctor, you need to get a full thyroid panel. Do not depend on just the TSH. And we'll do further webinars really focusing on thyroid. But we want to check TSH, free T4, free T3, reverse T3, and the thyroid antibody. So you have to do that in order to get a full picture of the thyroid if it's functioning optimally. And then we also can do some other testing. Your levels might be kind of within range, a little bit low normal. We can do things. We have a test called the BMR, which you maybe have done with a personal trainer. And we are measuring your basal metabolic rate when you're at rest. We're trying to simulate what it's like for you before you get out of bed in the morning. How many calories are you burning? And what we find with people who are overweight and for whom their thyroid is not working right is their basal metabolic rate is on slow motion. We do the calculation. It'll say this person should, according to the tables we use, they should burn, say, 1,800 calories as a minimum. We have them breathe into a tube for 10 minutes. It measures how many calories they burn, and almost inevitably it's a couple hundred, if not 400 or 500 calories less. So if you have that test done, say it's 1,800 is what you should be burning, and you're only burning 1,200. What does that mean? That for you to maintain your weight, you have to reduce your caloric intake by 600 calories a day, or you have to go out and run 6 miles a day. Right? That's for some, we have patients come in and it's proving, they're saying, I know, I understand that. I've been only eating, I swear, in order to maintain my weight, I can only eat 800 calories a day. So this is their body's way of proving this. We have tests to actually show that this is what's going on. And we always look to the thyroid because the thyroid is in charge of this basal metabolic rate, as well as body temperature. Think of it as the idle in your car. So it's getting your metabolism up so you can move through life. The typical hypothyroid person is fatigued, overweight, tends to be colder, just sort of that picture. We also see the athlete. This is the person who says, I've always run 5 miles every day. And they're in a unique picture because they don't feel right unless they really can get their metabolism going, and they only feel normal running 5 miles a day because they've cranked up their metabolism or their thyroid, and now they feel like, okay, now I'm just sort of normal and coasting. So you may say, well, I don't look like I'm hypothyroid, or the doctor says that you couldn't possibly be. The body type can be anybody. So you really want to check that full thyroid panel. So really this is the core for weight management, because it's basically just a signal that something is, your metabolism is off if you are eating healthy and if you're exercising right. The next thing we're going to look at is adrenals. There are 3 adrenal hormones: cortisol, DHEA, and pregnenolone. And adrenals are responsible for how we handle stress. And if we are under stress, your body will store fat. Think of it as, what is your body trying to do? It thinks you're running from the tiger, especially if you're doing extreme dieting. The body says, wow, there's no food coming in. We better hold on to this. So it stores fat so that you can start to use it as energy. So you need to have your adrenal levels checked. It's interesting, there's a lot of talk about high cortisol, and it's common. You see it in the drugstore now. There's sort of CortiSlim and Corticorts and all these supplements to take, and basically what they have is caffeine in them to rev your metabolism up, but which is actually the opposite of what you want to be doing. If your cortisol is high, it means that you are always on this adrenaline fight or flight picture. And if your cortisol is low, it's that fatigued, can't get out of bed in the morning picture. That also might be part of the thyroid. There's a mixed picture here. We can't always, by talking to you, Sometimes when I see patients, I'm not sure if you have low cortisol or high yet by talking. You know, other things I can usually figure it out by your clinical symptoms. That one's a little tricky. I don't know if you're burning the candle at both ends or if you've already burnt the candle at both ends. But either way, this is going to help. This is going to slow your metabolism down because you're in stress and you're going to store fat. So if your cortisol is high, we've got the stress factor in here. So we'll do it. We all have stress in our lives, obviously. And it's also, it keeps us motivated. It's our energy in life. But if you are under large amounts of stress that you're not handling well, that's either overwhelming or it's something that you're not able to face, there's no way you can lose weight. I have so many, I'm sure you have friends like this, that they didn't lose weight until they got a divorce or until they moved to the city they wanted to move to, or they got fired from their job and all of a sudden they lost weight. So there's always seems to be this mental emotional picture with weight. You know, we played on the play on words talking about the weight is over tonight. It really works this way too. Most people who are heavy also say, you know, I feel like my life is on hold or I'm waiting for something. I just can't seem to get on with my life. So if we're going to learn about our health, we have to learn about all aspects of our health. It's not to say that it's psychosomatic and if you just change your thoughts, everything will change. But it's just trying to say that our body is talking to us in a way that is also related to the other aspects of our life. So if we're going to do a comprehensive health plan, we're going to do a comprehensive plan review of everything that's going on in our life. And if you don't have a doctor that's willing to at least understand some of these aspects, again, you're not going to get a full picture of your health. The other thing that kind of goes along with this stress picture is sleep. Of course, this week I had more patients than usual come in with weight issues. Just, you know, it's probably because we're going to do this talk. And I had a woman come in. She's doing great. She's happy. She's still, you know, she's gotten more energy. She's exercising more. But she had these really big bags under her eyes. She is not sleeping well. So the body perceives that as stress. It says, we're running from the tire. We better just hold on to things. There's no way you can have a healthy weight if you're not sleeping enough. And it's the same picture, just everything works together. I wish, again, it were simple. I could give you a magic pill. It just doesn't work that way. Our body's talking to us. So if you're not sleeping enough, and especially if you have anything like sleep apnea, so if you're snoring, if you wake up startled in the middle of the night, ask your partner. We might want to do a sleep study. So that's another picture that we have to address if we're going to address weight. And sometimes, you know, fixing these fixes this, sometimes fixing weight fixes the other. There's no direct linear path into our lives, but, you know, there really isn't with any other aspect either. Let's see here. I'm going to do food in a second. Okay. Blood sugar. So this one is great because we can see this right away in your blood test. If your blood sugar is high, so there's a couple ways to check it. When you just get your basic comprehensive metabolic profile, it'll be included in there. If you do it, you should go fasting in the early morning, 7 to 10 a.m., and they'll see your glucose. Now the glucose is a good measure, but it's only a snapshot of your blood sugar, how it responded to what you did the prior 12 to 24 hours. So this is one good view in. More importantly, especially if you're overweight, we should check your hemoglobin A1C. This is a measure of your average blood sugar over a 90-day period because it's the measure of the sugar that is attached to hemoglobin in the red blood cells. This will give us the perfect clue. I love it when my patients' numbers are high because this is your body talking to us and it says we can't handle the sugar or the carbohydrates you're eating. And everybody's different. So they're saying, so this is the kind of person I ask you what you're eating. I'm not eating very much. I have granola in the morning, a piece of toast, and a glass of orange juice. Lunch, I just have a half a sandwich. Dinner, just a little bit of pasta and vegetables. So for somebody that might be a fine diet, but your body just showed us that your blood sugar is high, so you can't handle these carbohydrates. The granola is chock full of carbohydrates, which are forms of sugar. The orange juice, the sandwich at lunch. So what we start with this person is not necessarily reducing total calories, because that wasn't a lot of calories. And again, most patients who come in are really not overeating, but they're eating the wrong types of the macronutrients. So we need a certain amount of protein and fat, and it's usually, this is the first thing to go, that we need to have go. This is usually the best thing we can do to help people with weight loss, is cutting down the carbohydrates. And I know you're reading all about it, paleo this, no carbs, what's a carb, what's a sugar, all this. It gets a little bit complicated. Sherry, over the next few weeks too, Sherry and I are going to give some other helpful hints for how to eat right. But if you've got this going on, carbohydrates, what are they? Crackers, cookies, candy, pasta, bread, juices, and sometimes even fruit. So somebody will say to me, but apples, they're not bad. They're not bad, they're wonderful, but you might not be able to handle a full apple at a sitting. You might have to have a quarter of an apple with a piece of cheese or with some nuts. And this is great because it's not me telling you, this is your blood test telling you. Okay? So this is, most people have to go this direction to some degree anyway. Some people are saying, oh, I just can't handle eating a piece of bread. I just gained 5 pounds. That's your body talking to you. So we're going to go with that, and we're going to keep following that. We're going to find a way to make sure you're getting a full, complete dietary regimen with your proteins and your good fats and your vegetables. So this is probably, as far as starting to change your behaviors and your dietary clue, this is where we're going to go. Things like people say, I'm eating a cup of non-fat yogurt. Sounds healthy enough. It actually has a lot of sugar in it. So you start reading the carbohydrates on the label. And the final advice with food is read labels really, really carefully, mainly minimizing the carbohydrates, and then don't eat food with labels on it, right? Trees don't have, beef doesn't have a label on it when you see it out in nature. All the things that have labels are things that we've concocted, and they're not even really real food. And if your weight is up, it's telling you that these are not appropriate foods for you. Okay? The next thing we want to look at are hormones. Especially, 40 and older. So we talked about this in the perimenopause, the menopause talk. Our hormones all come from cholesterol. So it's a nutrient really that we have in our body. So in order to make hormones, we convert it from cholesterol. We make pregnenolone, DHEA, testosterone, estradiol, progesterone. All of our hormones come from there. What seems to happen in perimenopause and menopause, the ovaries stop functioning, so the body says, how do we make these hormones? Let's hold on to that base ingredient and see if we can make it there in the fat tissue. And the body can do it because there are enzymes there that can do some peripheral conversion. It doesn't do a very good job. So your body will store cholesterol. Cholesterol notoriously shoots up middle age if your thyroid is not well managed, if you're going through perimenopause, and if you're starting to put on weight. Again, it's sort of circular. So, and this can also happen if your estrogen's a little high and your progesterone is not high enough. Progesterone is a diuretic, so it helps the puffiness and the water retention. If you got a lot of that during your PMS time when you were younger, now when you go through perimenopause, there's a good chance that you'll need some progesterone, and that can help resolve some of this weight picture too. I talked already a little bit about the mental, emotional aspect of it, but it's at least 30% of what's going on. So it needs to be addressed. Do it, with us. Do some journaling around it. I have some patients that have early trauma that they've remembered, and weight seems to be a kind of a way of cushioning and padding. We have sexual issues, people not comfortable with their sexuality and they've padded. So this is huge as far as affecting the weight. Then let's look at cravings before we give a little overview of food before I turn the floor over to Sherry. So cravings, we kind of have two types, right? One are the physical cravings for certain kinds of food, and the other one are the emotional cravings, more psychological. With women, the main reason why we have those cravings, especially for carbohydrates, sugars, things like that, especially the late night binging, is to increase serotonin. So serotonin is the feel-good neurotransmitter. So, and it works, right? People say, oh, I was so stressed at work, I had a bowl of ice cream and I just mellowed out. So it does work for that. And so there's a few things to look at. One is, do you have an imbalance with the neurotransmitters? So is there something kind of on the biochemical pathway that we want to correct? And then what's going on emotionally? So whenever I say someone's having a lot of sugar cravings and we're working towards eliminating those, but it's a tricky issue, I say protein first. This is my trick I'm going to give you today to deal with cravings, especially sugar cravings. First of all, I'm going to be setting up your diet to especially front load much more protein in your day. If most overweight people are not eating breakfast right away, you've got to get some protein in first thing. And one of the reasons is to feed those neurotransmitters. So it's calming the brain. So say every day at 4 o'clock, the jelly bean bowl gets passed around at your work and you just cannot resist and you're tired and it gives you a little pick-me-up, okay? So this is what you're going to do. You see the jelly beans there. You know you're going to take them. Don't worry about it. Don't fight yourself on it. Make yourself eat some protein first. Get some turkey slices that you keep in the refrigerator at home. Make some hard-boiled eggs. Make a dozen of them tonight when we finish this talk, so they're in the refrigerator. Go get some beef jerky. Get a good organic or grass-fed one. Maybe some almonds will do it for you. Not necessarily, because there's a lot of carbohydrates and fat in there too. It seems to not quite feed the neurotransmitters as well. Eat that protein and just wait a minute or two, and you'll notice that the physical craving for the candy won't be there. You'll feel a sense of kind of resetting and calm in your brain. The habit might still be there, and you might go ahead and eat them. Don't worry about it. We're just kind of trying to train you for what does it feel like when you feed your brain appropriately, and watch your thought process, watch your emotional set. The late night, as I said, the late night binging is a little bit trickier, but if you do the same thing, I know I'm going to eat that bowl of ice cream when I walk in the house, just say, I'm going to eat some protein first. And just get it in. And you'll watch things shift. And the other way to work on that is whenever you have a sugar craving, ask yourself how much protein you've had in the last couple of meals, and you probably have not had enough. And fat also. So we want to get so that we are satisfying our energy levels through the brain, those neurotransmitters, as well as through energy, right? Getting enough calories and energy so we can go about our day. Let's talk a little bit more about food, obviously. We've gotten kind of this strange relationship with food. I get, especially women, I think, well, we've gotten where we think food is evil. Like, I can't eat this, and I can't eat this, and I can't eat this, and everything's bad for me, and I promise now I'm just having these little powdered smoothies. It doesn't work that way. And, that we haven't really changed our genetics genetics don't change, more than over several thousands and thousands of years. So it's not, our body really is not adjusted to eating processed food, first of all. And let's talk again, hooking back in the mental emotional part. What is food? Food is our way of interacting with our environment. It's how we get energy. As humans, we can't make our own energy. Plants can. They're just in the sun. They get energy from the sun. They do photosynthesis, and that's how plants can grow. We can't do that, so we have to eat plants and eat other nutrients in order to get our energy. So this is how we get energy to move through our day, again, to live out our purpose. So if you're only eating 800 calories a day, and you're saying, but I know I can't handle anymore, you're only eating 800 calories a day and you're fatigued, it's a little bit like saying, I don't know why my car doesn't run. And they say, how much gas is in there? Oh no, I can't put gas in it. Right? So we really have to really change our relationship to food. And I know it's tricky if your thyroid is off, if your adrenals are off, if you're not getting enough sleep. You're right. Anything you eat, nothing's working. So we do have to do all of these systems together. And it's not easy. I'm not telling you it's easy, but it's what your body's asking you to do right now. Okay. So that's the deal with the cravings and the food. So usually the best thing to start when you're making these adjustments, while you're getting all your blood tests done and checking the thyroid, checking adrenals, checking your female hormones, checking your cholesterol level too, that's part of the picture too, looking at your sleep habits, getting a sleep study if you know you snore a lot, and checking all these out. And obviously exercises, it goes immune. You can't lose weight without finding what kind of exercise works for you. And it's different for everybody. Some people just go for a little stroll every morning. That's perfect for them. They have a nice relationship out with nature. They get their heart rate just enough. They're relaxed. They're happy. That's fine. Some people need to do heavy aerobics. Some people need to lift weights. It's different for everybody, but you've got to be moving. Again, that's what our bodies were designed to do. We're not designed to be sitting indoors all day long. So now some people are exercising too much, and that's leading to this stress response. So sometimes I'll have people back off a little bit, especially if they're not sleeping enough. So when you're tired and overweight, the first thing we want to do is have you sleep first. Then we're going to introduce more exercise as you start feeling better. We don't want to force it, especially if you're the type of person who you exercise and you used to feel great afterwards, and now it's not. Then it's because you're so fatigued and your adrenals are probably too low. So we don't want to push the exercise. So with the food, we want to start out, we got to introduce protein pretty much first thing in the morning. So start with 1 egg, or there's some great pre-cooked chicken sausages. You can start with one of those. Even if you're not hungry, that's also a sign that your metabolism is just on slow motion. So we've got to introduce some protein in the diet. And while we're adjusting your thyroid and your adrenals, your hormones, you're probably going to start getting hungrier. This is not the time to take an appetite suppressant. That's a really good sign. If you're eating breakfast and you're getting hungry by lunch, this is the healthy way of living where we have cravings for healthy food. We get hungry, we eat, we get satisfied, we keep moving. So introducing, at this stage of the game, I'm going to give lots more clues over the weeks, but the protein is the first thing, and I say that even if you sit down for your meal and you've got your protein and your vegetables on there, especially if you're hungry or if you're starting to get a little depressed or moody or anxious, eat the protein first. Literally eat the chicken first on your plate and then eat the rest, and you'll feel that sense of calm coming down, because otherwise you're going to be eating the chips, right? That's that sort of like trying to feed something and you're never satisfying it. So get the protein in to feed those neurotransmitters. I think we're going to I know some questions are coming in. We're going to do those at the end of the session. So I'd like to introduce to you Sherry. If you've been a patient here or you've ever called us, you've spoken to Sherry on the phone. She's our patient coordinator. And she is going to talk to you about a special diet program that we like, and you've probably seen it all over the news. It's the HCG diet. She's going to talk to you all about it, and I want to tell you when I like to use it. If you're over 200 pounds and just, you can't get started, you're not eating right, you can't seem to make the changes in your diet, and you feel inflamed, your immune system's not great, and you try stopping things for a while and it doesn't work. HCG is great for that kind of a person because it's regimented, but it is healthy food, and you'll get the feeling of not having any inflammation in the body because you're not eating any junk. So it's wonderful for that. So Sherry, as I said, she'll explain you the details about it. So it's wonderful if you're just overweight and you can't, in quite a lot, because you will lose weight fast, and it's keeping you, introducing you to healthy food choices. The other kind of person is, and by the way, the diet will not work if these are not, at least we're not working on them simultaneously. So don't do any kind of diet like that if we haven't checked your thyroid. It's just going to be, it could be fruitless for you. It's also, a lot of men do pretty well on it. They just do tend to lose weight faster, and they are usually ones who haven't been eating as well either, so they optimize their diet. But by doing this, my favorite thing about it is that it reduces inflammation entirely, and so you're going to feel how great it is to have no inflammation in the body, and then your cravings, they almost always go away as well. So we'll talk you through all of that. And I think we're ready for Sherry, and then we'll come back with questions. So if you do have questions online, type them in. I think some are coming in. We'll do some Facebook questions and Twitter. And we have to do a microphone change here. So can you come and help us, please, Jenny?
I'm Sherry Good, and I'm the new patient consultant here at HMG. And I got involved with the HCG because the doctors like for the patients to check in once a week and go over their successes or any roadblocks and have time to talk to somebody. So if you do the program, then you have the opportunity of calling in once a week, and I can help you through it. So I love everything that I've learned from the patients. And then from the patients, I got excited and I did it myself because I wanted to experience, does it really do all the things that these patients are coming back and telling me that it's doing? And it was incredible to discover it for myself, and it really did work. The two things I'm thinking about are increased energy and lowered appetite. So that really got me interested. And I did experience that, and so I can with confidence tell patients when they're starting the program that yes, these are the things we'll experience. So first, let me just define HCG and then tell you a little bit about why we think it's one of the best, efficient, effective weight loss tools, a little bit about maintenance, and then long-term permanent weight loss, because quite frankly, that's what we're all interested in. We don't want to just get it off, gain it all back. We've already done that. HCG stands for human chorionic gonadotropin. Chorionic having to do with the little villa-like fingers, the outermost layer of the embryo, and its little villa-like fingers reaching towards the blood supply, and it's this hormone that sets that in motion during pregnancy. Gonadotropin having to do with reproductive hormones from the pituitary, like follicle-stimulating hormone, luteinizing hormone. A lot of women say, well, I associate my pregnancies with that time in my life when I gained a lot of weight and I couldn't get back to previous weight. So why are we revisiting a pregnancy hormone? And a lot of men wonder, yeah, what does this have to do with men and weight loss? That's just one of the things that HCG hormone does. The other thing that HCG hormone does, this leads us to Dr. Simeon's manuscript from the early 50s, Pounds and Inches, and many of you may have read that, or you can access it online. It's real interesting reading. And in that manuscript, he describes 3 types of fat. The fat that buffers our organs, which is very necessary, the immediate fat reserves. So if you or I go on a casual weight loss and we lose 5 or 10 pretty quick and we're going, yeah, I can do this, but then it doesn't go any further, that's the immediate fat reserve. And then there's the stubborn fat stores. Okay, now we're getting serious. We're really going to watch what we eat. We're really working out. We even hired a trainer, and it still won't budge, those real stubborn fat stores. So this is where the HCG comes into play. He talks about the hypothesis was how come pregnant women in a famine state wouldn't die, or the baby wouldn't die at the same rate someone else in a famine state would perish. And this is when he isolated what that hormone will do. In a famine state or a very low calorie diet, which is what we're doing on HCG, we are simulating a very low calorie famine state with the intent to activate that hormone, because that will set that hormone into motion and it will seek out those fat stores like a guided missile. And then it will start to dump about a pound a day, or as we go, then maybe every other day. And here's what people must realize is that every pound we start to lose is 3,500 calories. So if we're eating 500 to 700 calories and our body is dumping 3,500 calories, that's what lowers your appetite. This is not an appetite suppressant. You're not having to get by on willpower. If you or I ate 500 calories and we weren't on HCG, we'd last about 2 days. Our body would turn and start to eat the muscle, very detrimental, and that's not what we're doing with HCG. When we go on the low-calorie diet, we're activating that hormone that we're taking to do what it can do. We're essentially feeding off of our own fat. I know that sounds kind of crude, and how many times have we wished we could, but what would make that happen? This hormone will set that in motion. Most people that need to lose 20 to 25 pounds can probably achieve that in one round, which is about 30 to 40 days. And we'll customize that to each person, how if they need to just do it 30 days or if they need to do a full 40. If you need to lose 50 to 75 pounds, you'll probably do 2 to 3 rounds. And if you need to lose 100 plus, that'll probably be minimal 4 rounds. And you may not actually do those back to back. We'll probably break them up, because if you do HCG just nonstop for a long period of time, you can build up immunity. There won't be any harm. It just will build up a little immunity, and then you stop dropping that pound every other day, and you plateau, and you go, wait a minute, it's not working. Well, that's why we monitor you from round to round, and we take a little break if we need to. So, and let me paint another picture. If a person is 200 pounds and they've always jockeyed right there, 195 to 205, and they can't break that little area. Let's just say their goal is 150. So now we get down to 150. Well, don't worry about gaining a pound or two, because chances are what will happen is you'll jockey now in this whole new range. My suggestion, after we also look at these other wonderful things that Dr. Evans talked about, and that is part of the whole picture, my suggestion for patients is, if they feel they're starting to gain a little bit and it's getting a little out of that jockeying range, which it shouldn't run away, but if it starts to and they get nervous, my suggestion is that we do 1 round of HCG once a year to always bring you back to that new set point. Because as we get older, a lot of women gain about 10 pounds per decade. And so now she's 50 and she's worried that by, she's just going to keep gaining that weight. Well, if from year to year, if we always bring her back to that set point, it's a lot easier to do. We're talking about 5 to 10, maybe 20 pounds instead of 50 plus pounds. And that way, we always bring her back to the set point. So once we get the bulk of that weight off, and it comes off pretty quickly, you're not hungry, you have a resurgence of energy, you are detoxing, and that also helps cut down on the cravings. You know how when you eat a lot of sugar, you want more sugar? Well, we're getting the sugar and the fats out of storage, and so it's breaking that cycle. You don't have as many cravings, which is really good. So once you get to your goal weight, we want to do about a 3-week maintenance. That's where you double your calories, you can expand the variety of foods, and part of what we're doing here is to just slowly walk back into the eating arena and not gain too much too fast. But the other key thing we're doing with that 3-week period of time is helping to reset the metabolism. The yo-yo dieting, our survival being threatened, that really wrecks the metabolism. So what we're doing with HCG and that 3-week maintenance is basically retraining your metabolism. So it's a very essential step. So now we get you past the maintenance and you go, okay, now what? I'm afraid to go back into the real world. I know I'm going to just go back to my old eating habits. You might be pleasantly surprised that when you go back to your routine, and hopefully we've trained you on some of the better eating ways by the time you get to that point, you'll be eating along and you'll find that you start to get full about where you got full on the HCG. Your metabolism is resetting. And then I just briefly want to touch on the other 2 aspects that Dr. Evans mentioned. Literally with HCG, you're dumping about a pound of fat a day or every other day. That's 3,500 calories. That's what lowers your appetite. We're cleansing, so it breaks your cravings. Those are the key factors of why this is very different than just a starvation diet. But to touch on these other 2 things, and then I'll wrap it up, I just want to tell a little story. Anecdotal. Back in the 80s, there was a movie called Haunted Summer, and the actors were portraying real-life poet Lord Byron, writer Mary Shelley, who wrote Frankenstein, and her poet husband, Percy Shelley. And they're out on the lawn in the summer having this very proper picnic in the early 1800s, and they're having a philosophical discussion. And Lord Byron rather condescendingly asks Mary Shelley, what is it that women want? And she said, it's very simple. She said, we want 2 things. We want to develop our minds and control our own bodies. And it just hit me like a ton of bricks. I went, wow, it would take a writer to sum it up that succinctly. And that has stayed with me ever since. Of course, that was all before my actual physical problems began. I had no earthly idea that your health could just go out from under your feet, especially by midlife. But that stuck with me. And I think all of us in our lifetime have witnessed the incredible advances of both men and women, but women in particular, in the last 50 to 100 years. It's been incredible to watch what women have been able to achieve. The other thing that I have witnessed as a new patient consultant in the last 10 years is to watch many of these same women have to step down from these incredible positions that they had risen to. They're highly educated, they're highly accomplished, women of all walks, really. They have to step down because they can no longer speak in full and clear sentences. They can't think, focus, concentrate, remember. Their metabolism that used to be really good, it just goes wacky. And all of a sudden she has this unexplained, runaway weight gain. And it's really bothersome. She can't move as well. She doesn't feel good in her skin. All the things she did to lose weight in the past, they don't work anymore. So she's really getting nervous. A lot of these women will confide to me as the consultant that they cry a lot when they don't think anyone is watching. They often are gripped by an overwhelming anxiety and panic at night, and this shatters their sleep. And they wake up in the morning with dark circles under their eyes, and they don't feel refreshed. And as this happens every day, and they just feel they're losing the control and the grip of their life, many of them actually have to step down. And it's just so hard to watch when women have risen so high, only to be stepping down because their health gives way. The wonderful thing about where we are in this time and place is we know now what we need to do to rebuild her endocrine system when it evaporates out from underneath her. Nobody warns her. Nobody warns men or women that these are the things that are going to happen as you age. They just say, you're simply getting older. Now we know that we're losing specific hormones at specific times, and these are the symptoms. And if you mimic nature and put the natural hormones back in the body, it starts to act like it used to. And now she has the ability to increase her knowledge and aspire to the goal. So that's why what you were saying was so wonderful, is if we keep the physical in good shape, it allows us to achieve our purpose, our goals, our dreams, and our creativity. I don't think anyone realizes that's in the creative arts, whether it's writing, music, art, that when your health goes, when your neurotransmitters go, when your thyroid is gone or out of balance, that your creativity is grossly affected. And when we get the hormone foundation restored, suddenly it's like the energy starts to flow again, and she gets past the writer's block, or she has the idea again, and now she can achieve her goals. So it really does boil down to developing our minds and controlling our bodies. But we know so much more how to control our bodies. And then and also the key about the hormones is it's the second thing to help continue keeping that metabolism good. We've reset it with the HCG. Now with the hormone rebuilding, the foundation rebuilding, we actually are continuing to ensure the success of the metabolism. And then lastly, with lifestyle changes, just as Dr. Evans said, at our clinic, we don't necessarily advocate one eating program. There really isn't one size fits all. Instead of thinking deprivation, low calorie, low fat, we would like our patients to start thinking anti-inflammatory. Start eating a diet that's anti-inflammatory, and it will also further ensure that metabolism, but it'll also reduce the pain, because most of our patients don't just have a weight issue and then no other issues. They have a lot of pain, a lot of inflammation, headaches, swelling, puffiness. So that's why eating a more anti-inflammatory diet will be helpful for that. I know I've gone over this kind of quickly, and if anyone has any more questions, as a new patient consultant, I'm available 5 days a week. You can call me anytime. This is a service that Dr. Holthorf provides for you to call, ask questions, and we can talk for as long as you need to. And then if you would like to get set up, we can certainly help with that. To utilize me, I would like to answer your questions if you call in. And that's all I have. I don't know if you want to answer any questions or... Okay, thank you. All right, here you go.
Thank you, Sherry. You can tell she's a great patient coordinator. So yeah, I will have patients that we're working on all these issues. They'll go on the HCG diet, and I have them call Sherry once a week to have her prep them, get them started. She has some great cooking techniques also to how to make. It's a very simple, plain diet. It's basically sort of a chicken breast and a piece, one vegetable serving a couple times a day. She has ways to make it kind of taste a little juicier while you're going through it. We have some questions. Before, I also want to talk, we're not excluding men by any stretch of the imagination. What's interesting with men, especially this middle-age weight gain, is when it shows up, is that it shows up as the waist getting thicker, right? Sometimes they even get gynecomastia, the male breasts. And yet, so this middle waist weight gain is usually, it can be these other issues. They also could be someone who's eaten junk all their life, and now it's just their body's saying, time to wake up. So it's caused all this inflammation. Their thyroid might be off. Thyroid tends to be have a much more profound impact on women than it does on men, but some men need that as well. It's often their testosterone levels that start to drop. What happens simultaneously is the fat cells can convert testosterone to estrogen. And so it starts slowing down their metabolism. That's how they get that weight change, those weight changes. And so those feed each other. We have some more questions too. And then I want to just touch on a few I know you're looking for magic bullets, and there are lots of things we can add into the picture. There are medications to work with this blood sugar picture. We can do all of it with diet, by the way, with healthy diet, reducing carbohydrates. All of your pre-diabetic insulin resistance will go away, but we can also do it with some help. So we have lots of different medications we can do here. I didn't talk about leptin. Leptin is a hormone. It's basically produced by the fat cells. It's not, again, it's not sort of this magic bullet. If you're overweight, you have a lot of fat cells, you're going to have high leptin, and it's basically going to suppress thyroid function. So don't think it's another magic bullet. Oh, if I just get my leptin levels done, that's the answer. It's not. It's a contributory factor. It helps prove that your thyroid is not optimal. There are medications and supplements to help work with that. So if your leptin is high, if your blood sugar is high, we can add some medications and supplements into the picture. We can, there's also, so somebody asked, we have about 3 or 4 questions here. One of them is, what is the best way to increase motivation in patients? So if things aren't working, you're not going to be motivated. So if we give you something that doesn't work, that's usually half the reason is people have lost hope. They've tried all these things and nothing's worked. And it's usually because they've done all these crazy diets and they've never looked at the core issues in their body. So motivation and willpower are not the answer. So I never pressure somebody into that. If you've already come to see us, you're motivated enough to ask more questions. That's really all you need in your life, is the motivation to ask the questions and then to keep seeking out some answers. So the way to increase the motivation is, for us to optimize all your metabolic processes so you start to see results. And then, usually it is also asking that deeper question, what's your real purpose? If it's to play with your grandchildren, then that's going to increase your motivation if you find that you can't bend over to play with your kids. If it's to get that promotion at work and you realize that you were uncomfortable standing in front of a group of people because of the way you look, then that's going to be your motivator. But everybody's got their own. And I never kind of put pressure on, again, with this whole willpower picture. And it's also creating, the other part about this, how to create motivation, is creating a relationship. I mean, that's what we're going to do with you here. We might not, it may take us a while to sort out what your precise issue is, but we're going to stay there with you until we figure it out. The doctor doesn't have any more answers than you do, but we'll kind of escort you into digging in deeper to find out the solutions. Somebody said, this is interesting, she did the HCG diet, she reached her goal weight, but she said she gained cellulite, which she's never had before. So what's interesting is that if you think of somebody who's heavy, there's, a lot of fat, but it might not be cellulite. So I think what's probably happened with her is that she's lost the fat, and it's almost like stretch marks is what I'm suspecting, that it's not really sort of new fat, it's that it's actually the skin, it's a little bit less fat there, and so it's looking more dimply. So with the HCG, since it's a very reduced caloric intake, we really suggest you don't exercise much while you're on it. If you say run 5 miles a day, we'll say cut it back, maybe 2 miles a day or 2 miles every other day while you're going through this. So the key probably with that cellulite is to start exercising again, which you'll be ready to do because you feel great, you look good, you have no inflammation, your pain has been reduced. So that's really going to work on that issue. Somebody said, how do you increase metabolism? So remember, the cause of a slow metabolism and really the measure of your metabolism is your thyroid. So if you, and we've done that basal metabolic rate test, so if your metabolism is low, we know it's related to your thyroid as well as these other issues. And it might be because you're not eating enough. Again, think of the image of a fire. If you're not putting any fuel in it, it's going to be a very low flame. So we want to stoke that fire enough to increase the metabolism and get that going. There are medications to do it. We can add things like, we have many patients who've done phentermine and things like that. They're basically, a stimulant in the body, but in the long run, it's going to reduce your appetite. It's a drug. It's not going to get at these core issues. It's a crutch. Sometimes it's a great crutch if your cravings are really difficult to handle at the beginning. But we want you to have a healthy cravings for healthy food. We want you to feel hungry and then satisfied. We don't want you to have sort of no sensation and this distaste and disregard for food. So the metabolism is mainly the thyroid issue. We do have some things that I do like. We have 2 forms of B12 injections. B12, again, we would check your levels to see if you're low in B12. There's a one shot, we call them Lipo-B, and they're used, you'll find them around. It has methionine, inositol, and choline in it, and those are 3 amino acids that do help burn fat as well. So that can be done in conjunction with the HCG diet, and they'll give you energy too while you're going through it. More questions? Did you have some? Great. We have an online reviewer question.
She would like to know if you're eating every small meal, how many should you do and how long should you take out? That's better for you.
Right. So the question is, eating small meals, is it better to eat small meals? How many should you eat? How should you spread them out? So this one is a little bit individual as well. Really, if you are eating healthy, substantial meals, you might not need to snack in between. So everybody's different on this one. What I first like to do is introduce that protein in the morning and find out how soon you get hungry. Some people say, gosh, I usually don't eat breakfast, or I just drink my coffee and it suppresses my appetite, and I don't even remember to eat until 4 o'clock. So if you're doing it that way, your body thinks you're in the desert, there's no food for miles, we better hold on to this fat for dear life. And we're going to make you foggy brain and fall asleep so you don't use extra energy. So starting out adding more protein, we'll see what that starts to do with the appropriate endocrine management, and we'll see how soon you need to eat. So everybody's a little different. If you tend to get lightheaded between meals, then we are going to want to, again, make sure you get protein because that's sustained energy. But I don't like necessarily saying you have to have these small meals, because some people that just feels like munching all day long and they're just basically, again, not eating enough protein and fat. There's no real answer, but you want to feel slightly hungry before your next meal. However, if you've been dieting forever, you don't even really know what it's like to be hungry. You've suppressed that. So you'll need to start think of food as fuel rather than kind of this emotional habit and all of that. So if it's fuel, when do you replace the gas in your car? Do you do it at half a tank? Some people do, right? Because that's where the gas station is near your house, and you know you're going to go for a long drive later, so you need the full tank of gas. Or some people wait till it's a quarter. That's probably the most usual one to do. Some people wait till there's a drop left. That's the hypoglycemic one where you're starving now and you can't think straight and you've got to eat. So I don't have a specific answer for that, but we start working it through together and you start listening to how your body responds. I want you to get a little bit of hunger and satisfy it. So with a good amount of protein and fat, and then vegetables we know are of course, the main thing to add in the diet. Any other questions? Another one, good. Good.
She would like to know if for hypothyroidism, what's the recommended calories you should eat and how often should she work out with her blood sugar drop?
Yeah. So if somebody's blood sugar does drop, she's probably not eating enough protein consistently. So increase the amount of protein because that'll be sustained. And then if her blood sugar really is dropping, her adrenals are probably low. So if you're the kind of person when you bend over and stand up and you get lightheaded, and if you get kind of shaky between meals, then your adrenals are not adjusted properly. Your cortisol is probably low, which means when you get slightly stressed out, you go right into adrenaline and that shaky fight or flight, cold sweat kind of thing. So it sounds like this is what this person is describing. She's a little hypoglycemic. And we've given her she's on thyroid medication, so her metabolism might be stimulated and she's probably not eating enough. Now, as we're adjusting your thyroid, if your dose is too high, you can get really hungry, quick bowel movements. So that's also a sign your thyroid medication is too high. But that's the person then who's eating a lot and losing a lot of weight. So we do want to watch that aspect. But I don't have a set number of calories. What we would, did this break? No. Good, excuse me. If you're, we do your basal metabolic rate, and if it's matching what we expect from you, and if you're eating a good amount and burning those amount of calories and not gaining weight, then those are the right number of calories for you. So I'll work with you to help sort it out because it's hard to do on your own. So what is a healthy weight? A healthy weight is when if you eat right, you maintain. If you eat some junk, you put on some weight. And if you diet, you start losing, or if you skip meals, you start losing weight. So that's what a healthy weight is for you, in which you're finally at your optimum level and you feel like you can do all the activities you want to do. And I think we have a few more questions. Somebody said she started to put on weight when she was given progesterone. So progesterone usually acts like a diuretic, right? When we think of that PMS time, the puffiness that might happen, it's usually not enough progesterone. But in about probably 20% of women, they actually feel more PMS-y on progesterone. They get the breast tenderness, they get bloated, they might get headaches, they might get depressed. The type of person that usually happens to is the woman who has lower estrogen. So, and especially if she's gone through menopause and her estrogen isn't high enough, she may not tolerate enough progesterone. So on this woman, your dose might not be high enough. There's a couple things. Your estrogen dose might not be high enough, so you might not be able to handle the progesterone, or the progesterone could just be a little bit too high. So you're not crazy. The majority of women love progesterone, and it helps lose some weight, and it's a little bit more like a diuretic, but there is about 20% of women that they respond to differently. Any other questions? Other questions? No? Okay. So everything that our body tells us is just another view into our whole being. So remember, everything that goes on in the body is connected to everything else in our lives. There is no quick fix, but there are answers. We can really, we can solve a lot of this, especially, and then adding to your lifestyle changes, stress reduction, making whatever changes you need to make in your work and your relationships, and being on the right kinds of food. We want to have a healthy relationship with food. Lots of great proteins, lots of great good healthy fats, all the vegetables you can pretty much intake. Minimal sugar if you have any blood sugar pictures. Minimal fruit if you have the blood sugar pictures. That one we have to minimize for a while and slowly find out how much you can tolerate. And you want to make sure your doctor will listen to your concerns. Take them seriously. Get a complete review of your health with you. Work on this whole comprehensive approach, and we'll be there for you. So thanks again for joining us. We will have our next one will be next month. We haven't picked a date yet. It'll be Dr. Holtorf. He'll be giving a talk, and we have lots more lined up for you. If you have any questions or requests for topics you want us to go over, just email us, post them on Facebook, and we'll see you next month. Thanks again.
Thank you for joining us tonight for the Weight is Over Health Chat with Dr. Nancy Evans and Sherry Good. We hope you found this information useful as you look for weight loss solutions. If you would like to schedule a phone or office visit with Dr. Nancy Evans, just fill out the form below and Sherry will be contacting you. Next month, join Dr. Kent Holtorf with Answers and Solutions to Thyroid Disorders.